The idea was to try to focus on data coming out from these countries so that we can give more specific recommendations tailored to them based on data rather than expert opinion. But unfortunately, given the lack of personnel, resources, and the huge clinical burden, there's really not much of research coming out of these settings. So despite our extensive systematic review, focusing on databases from Africa and South America, we really didn't get answers to our questions that we had come up through our relatively large panel. And so what we did come up with was based mostly on expert opinion, give recommendations on what can be done. End of the day, I think the most important outcome was to have a document where we could talk about a research agenda, primarily because although the intention was to give evidence-based recommendations and modify or adapt the current recommendations, we really did not have much evidence to go with. So we distilled both the EULAR and GRAPPA guidelines and chose those that was most relevant based on our group. So we came up with some principles which essentially are similar to the GRAPPA and EULAR guidelines. Like we talk about goals of therapy, and the goal would be similar wherever you're in the world, that you needed to try to get into remission or minimal disease activity, you have to assess all domains, you have to manage comorbidities, and these comorbidities will be different in different parts of the world, and that is quite local to where the practitioner is. So we kind of emphasized that, and then talked about shared decision making and managing appropriate follow-up based on what is practical in that setting.